Good morning. My free paper is titled Vision-Related Quality of Life in Patients with Diabetic Macular Edema who are receiving intravitreal ranibizumab injection at a tertiary eye care hospital in Kerala. So among the various causes that contribute to a defective vision in patients suffering from diabetic retinopathy, diabetic macular edema has been identified as the most common cause, and various molecules have been implicated in its pathogenesis, of which the vascular endothelial growth factor is found to be the most predominant. Various treatment modalities are available, starting with laser photocoagulation, but now the mainstay of management is the use of the intravitreal anti-VEGF agents. The rationale behind the study was that many times the effectiveness of the intervention is assessed from the clinician's point of view based on the changes in the visual acuity and the changes in the macular thickness that is seen on the OCT. But this necessarily does not need to translate for a patient's satisfaction or an improvement for the quality of life for the patient's point of view. And also these injections are highly costly and many patients don't prefer to take a repeat injection. So I wanted to study a subjective quality, that is vision related quality of life in an objective manner, do a statistical analysis and see if whatever results we are getting, whether improvements or not, they are statistically significant or not, and no similar studies were done in Kerala. So the primary objective was to get a measure of the overall composite score for the vision related quality of life pre and post injection. And secondary objectives was to compare those various subdivisions that contribute to the vision related quality of life. It was a hospital-based observation longitudinal study done at a tertiary eye care hospital in Kerala, with my study population being patients who were diagnosed with diabetic macular edema and admitted for the intravitreal ranibizumab injection, from which patients were taken consecutively. The inclusion criteria was that they had to satisfy the definition of diabetic macular edema as given by the American Academy of Ophthalmology and admitted by their treating ophthalmologist for the injection. Patients who had received this injection prior, as well as having other ocular pathologies which could interfere with their vision related quality of life, were excluded from the study, and I had 40 patients for my study. So my study started with a baseline recording of the demographic data as well as recording details that were pertaining to the disease, followed by a detailed ophthalmological examination starting from the visual acuity up to the posterior segment fundus examination, as well as measuring their baseline OCT thickness, the central macular thickness on the OCT. And following this, I used my main tool for the study, which was the National Eye Institute Visual Function Questionnaire 25. And I administered the same questionnaire on the day prior to the injection and repeated the questionnaire at week number 2, 6, and 12 weeks post-injection. So my results were as follows. I had 40% males and 60% were females in my study, of which 55% were aged more than 60 and 45% were in the age group of 45 to 60. 40% received it in the right eye and 60% in the left eye. Looking at their OCT macular thickness, their baseline thickness, 31% are in the range of 600 to 700 micrometers, 28% were in the range of 500 to 600, 22% in the range of 400 to 500, and the rest 19 in the range of 300 to 400. Looking at the type of diabetic retinopathy among the patients that were a part of my study, 35% had severe NPDR, 33% had moderate NPDR, 7% had mild NPDR, and 25% had early PDR features. So this was my primary objective, which was analyzing the mean composite score. The questionnaire basically has a scoring method from which you can give a total score for the patient, which gives you an index of how much is their vision related quality of life. So my x-axis shows 4 values, 1, 2, 3, and 4, 1 corresponding to the baseline, 2 corresponding to the score at 2 weeks, 3 corresponding to the score at 6, and 4 corresponding to the score at 12 weeks. And mathematically an improvement in the value was seen, and on statistical analysis also it was significant with a p-value less than 0.05. Similarly, a few of those subscales of vision related quality of life were also analyzed, and they also showed similar statistically significant improvements post the injection at 2, 6, and 12 weeks. This was for the mean general vision score. This was regarding the mean distance activity score during the study period, the near activity score, then social functioning score, the mental health score. Coming to the discussion, my primary objective was to assess that overall composite score, and that showed an increase in value of 12.9 at 3 months, which was statistically significant. Similar studies which were done elsewhere also showed statistically significant improvements in the vision related quality of life, as the study done by LF Beto, where the composite score increased by 6.3 at 6 months, and the Ride and Rise study also, where it increased by 10.9 at 1 year. Similarly, my study also showed that all subscales showed an improvement over the study period, which was also, but in the LF-Beetle study, the main subscales that improved were the distance vision and the near vision. So the conclusion was that the diabetic macular edema does cause a great burden prior to any intervention, and which is statistically significantly showing an improvement in the vision-related quality of life post-injection. And these improvement was seen not only in the overall composite score, but even among the various sub-faculties that contribute. And so this shows that a single injection itself can bring about a great improvement and reduce the burden of the disease for these patients. These are my references. Thank you.
What is the dose of ranibizumab you have used?
So 0.5 mg, sir, in 0.05 ml.
Point
0.5 mg,
5,
0.05 ml, sir.
0.05 ml.
Yes, sir.
Did you find any complications after ranibizumab injections?
No, sir. So injection-related complications, no, sir.
So no development of endophthalmitis medicine all?
No, sir, no, sir.
Sure.
Yes, some of my study patients, I'm sure, sir.
I say in your study you have not.
Sorry, sir.
In your study you have not got anything.
No, sir, no, sir, no complications.
But actually, ranibizumab study, no, so many studies were there.
Okay.
What's the significance of your study here?
Sir, I wanted to look at the quality of life, sir. So, like, is it that injection is so expensive? Many patients in my setup also have come from a government college, sir. They don't opt for a second injection or a third injection. So that one injection itself causes a lot of economic burden. So is that really?
Suppose it again the problem increases, will you advise another injection or not? Because it has been told, no, at least 1 month, once in a month, you have to at least 3 injections,
Yes,
something
sir.
like that.
So the regimen states that we have to give it on a monthly basis for at least 3 months and then decide, sir. But if improvement is seen, sir, I would definitely ask for a repeat injection if the first
That
injection
means
happens.
patient have to pay or government is providing free?
Sir, my setup, sir, patient has to pay, sir.
In your hospital?
Yes.
It's government, no.
It's government, but the injection is bought by the patient, sir.
You are allowed to do that. Did you get permission?
Sorry, sir.
Did you get permission from others and all, from higher authorities?
Yes, sir. So, like, patients are generally admitted, sir, in the hospital, and the routine is like that, sir. They usually, even for not only my study, but for routine treatment purposes, the patient actually purchases the injection and it is being given at the hospitals.
No complaint, nothing. Nobody has complained. Achha, very, very nice. Okay, ma'am.
So, you have given injection only in one eye or both eyes?
So one eye.
Only in one eye. Better eye or worse eye?
The worst side.
Worse eye. And what was your observation after 3 months?
Sorry, madam.
What was your observation of central retinal thickness after 3 months? Was it increasing? Because you are giving only
Yes,
one
sir.
injection
Yes,
and
yes, sir.
observing after 3 months.
Yes.
So, was there any reduction in central macular thickness or
So not all patients, but many of the patients did show a reduction in the central macular thickness, sir.
Which college, man? You?
RIO Trivandrum.
Trivandrum.